I am Tom Flass. I'm a pediatric gastroenterologist, and I am starting here at St. Vincent Healthcare in the new pediatric specialty clinic, the Fortin Specialty Clinic. What drew me to pediatric GI was kind of a long road. First off, I actually have celiac disease and was undiagnosed for a long time and kind of suffered the consequences of that. And I think with a lot of GI diseases, both in pediatric and adults, there's a lot of undiagnosed or underdiagnosed disease out there. And so kind of my own experiences, and as I traveled along, hearing other people's stories of sort of suffering needlessly or delay in diagnosis. And that drove me into the field of nutrition initially, which is where I got my bachelor's and master's. But everything I was doing in nutrition really was related to medicine. And so then the transition became clear, and once I got into medical school, I wanted to go into a field that utilized nutrition as much as possible. And really pediatric GI was the field, probably more than any other area of medicine, that utilizes nutrition on a day-to-day basis and treating almost every condition that we treat. As a pediatric resident and as a pediatric GI fellow, I ended up taking care of a lot of kids from Montana who had to make the trek down to Denver for specialty care at the hospital, both outpatient and inpatient. And so kind of got to know some of these kids and their families, and then when the opportunity arose to actually practice in Billings with St. Vincent Healthcare and take the care directly to the patients instead of the patients having to travel all the way down to Denver, it just made a lot of sense, and it was something that needed to happen. So the things that stand out to me, especially making the transition from Denver to Billings, is the sense of community that it has here, both within the medical community and the community at large. It's obviously smaller than Denver, but people here get top-notch health care, and the medical community is a very tight-knit community and really, I think, has the best interest of serving the needs of the people of Montana and the kids of Montana at heart. We have something we often call Child Life, which is essentially treating the whole patient and their family and trying to have them have the best experience possible when they're getting a procedure or an inpatient in the hospital, whether it's sort of calming their fears or offering them coping techniques, working with the families on making their burden lighter and having a sick child. And it's really a fantastic service to have, and one I have been utilizing, will be utilizing more to try to improve the experience of the child when they're here. Just because it's a less populous state doesn't mean that we have certainly less significant disease here, and I'm glad to be here to be able to offer the services for all these things.